My favorite part of the job is to watch children grow and develop from infancy all the way through their years into early adulthood. It's a lot of fun. I think parents meet sort of unique challenges through both the toddler years and in adolescence. It's sort of interesting that they're both very similar periods, although the child has grown many years in the interim. They are times in the child's life when they're challenging the parents, looking for autonomy, looking to become their own individuals. So when I talk to adolescent parents, I often think I was saying those same things when they were toddlers, but it's their very similar years and very trying years for parents. Pediatrics has grown tremendously since I was a child. I think when I actually grew up in the city of Haverhill, and at that time, Dr. Rothman, who's sort of a well-known pediatrician before my time, was the only pediatrician in Haverhill, and it was a new thing to bring a child 40 years ago to a pediatrician. Since that time, pediatrics has grown tremendously, and children do benefit from having pediatric subspecialists and having general pediatricians who can care for their general medical needs. Children are not just small adults. They are indeed growing, changing individuals, and each phase of their development, I think, requires a specialist to care for them. We have nurse practitioners who assist us so that we can accommodate sick children the same day that they call, for the most part, which is very nice. Nobody likes to have a sick child overnight, so it's nice to be able to call that day and get an appointment that day. And all of our nurses really enjoy being a pediatric nurse. They enjoy the children. They don't necessarily enjoy giving the shots, but they enjoy the children and watching the children grow into young adults. So it's a very fun-loving team of healthcare providers in pediatrics. We have in the Haverhill office an on-site laboratory, X-ray. The X-ray even includes ultrasound, MRI, and CT scan. It's really wonderful for our patients to come in and be able to see us for a question of a fracture and get an X-ray without having to go to the hospital. We can do routine lab testing, lead testing, and anemia checks right here in the office. They don't have to go to the hospital for that. We as a practice have a good relationship with all the Boston hospitals, and in particular with Massachusetts General Hospital, where we can refer children who have specialized needs to specialists.